Hello, everyone. Good afternoon. Colleagues, partners, it's a very great pleasure to welcome all of you to EuroHealthNet's webinar on addressing psychosocial risks and supporting the mental health of older workers. So today we're going to be exploring policy and practice in action. The webinar comes in the context of the recent Mental Health Day on October 10th, as well as the current European Week of Safety and Health at Work. So we hope that information and connections that you're able to gain through today's event will support you as you participate in other initiatives, events, and campaigns during this period. So I want to first start by acknowledging my colleagues here in the room from EuroHealthNet, Lina Papartite, Dorota Sienkiewicz, and David Hargett, without whom this event wouldn't be happening. So really, thank you so much. It's been a great amount of work pulling this together, and so happy to see colleagues coming into the room as I speak. My name is Alison Mawson, and I'm one of EuroHealthNet's program managers, and I will be the moderator for today's session. So we're very excited that this webinar is an opportunity for us to come together, both with our members of the EuroHealthNet partnership, as well as with other actors in the mental health and occupational health spaces. And together we're going to be exploring the critical issue of mental health and well-being for older workers. So I think we all know that creating healthier workplaces for older workers is key to mitigating some of the economic and demographic pressures that we face across Europe. It's projected that already by 2030, older workers, who we can define as those age 55 and above, will represent already 55% of the European labor force. And as our workforce gets older and our working lives become longer, it has to become a greater priority for the European Union and for European national and regional governments to really promote healthy and health promoting workplaces. Apologies. So we know as well that older workers tend to experience more psychosocial risks at work than other groups tend to, other age groups. And in a rapidly evolving world of work, they may find that their skills become outdated faster than they're able to up and reskill. Precarious working contracts may also undermine their ability to build social and economic resources. And they're more likely to experience comorbidity of mental health issues with chronic illness or other health conditions, which can increase overall rates of sickness absence. They may also face greater conflict with work and family life obligations, such as caring responsibilities. However, we also know that when older workers are adequately supported and protected, they are tremendous assets to their organizations, their economies, and their societies. Promoting mental health at work is key to ensuring a healthy and active aging for all. It can delay the need for care and prevent premature retirement and disability. And as you're going to hear from our excellent lineup of speakers here with us today, mental health promotion and improving health and safety at work are key policy objectives, both for the European Union and the WHO European Regional Office, as well as for civil society actors from across Europe. For instance, our first speaker, who's joining us from the Directorate General for Employment, Social Affairs and Inclusion at the European Commission, will be speaking about tie-ins to the European Pillar of Social Rights, as well as the recently released European Care Strategy. Our second speaker, who's joining us from WHO Europe, will speak about the Mental Health Coalition, which is one of the 4 flagships of the current European Program of Work. Then we'll have 2 voices from civil society, first from Age Platform Europe, to understand really what's at stake in this discussion we're having, as well as from our own Dorota Sienkiewicz, policy manager at EuroHealthNet, who's going to be presenting 6 strategies for becoming an age-friendly and health-promoting employer. So these are directly drawn from a new policy briefing that EuroHealthNet released just last week, which we can certainly link here in the chat if you haven't already seen it. So after we hear from these experts, we're very excited to invite you to stay on for a short networking opportunity during which you can exchange about your experiences, practices, challenges, and other issues related to occupational mental health for older workers. This is the first time we're hosting such a virtual networking space in this free-form format, so we'll be very keen to have your feedback in a short evaluation that we'll be sending to you after we wrap up today's session. One additional housekeeping point to mention is that today's session is being recorded with the intention to publish the presentations on the EuroHealthNet website, but the networking session is only for internal purposes, for internal report writing purposes. So if you do have any concerns around recording, please do send us an email and we'd be happy to discuss that with you. So now, without further ado from my side, I'd like to warmly welcome our first speaker of the afternoon, Dr. Francisco Jesus Alvarez Hidalgo, a policy officer joining us from the Health and Safety at Work unit of DG Employment, or DG EMPL, as we call them here in Brussels. As he can only stay with us for a short period, the intention is to open the floor for question and answer immediately after his intervention. And then for our later speakers, we'll have a second round of Q&A after all have completed their interventions. So please do, in the meantime, feel free to use the chat, send us your comments, your questions, your feedback, and we'll be moderating that written discussion as well. So now I'm very pleased to hand the floor to Francisco Jesus to give us our first intervention of the day. Thank you.
Thank you very much, Alison, for the excellent introduction of the topic today. And it's a pleasure to be here with all of you and to share some information and some reflections about the exciting topic of mental health. And I will mainly, I would rather start by mentioning something that probably you know, is that mental health is now very, very high in the political agenda in my institution, in the European Commission. No? I will try to summarize very briefly the main elements of mental health in general in the EU, mental health at work, and also talk a little bit of mental health of older workers, which is the topic of today's webinar. No? Maybe I will start by the most recent development that certainly all of you probably know is the President of the Commission, Mrs. Ursula von der Leyen, very recently in the speech of the State of the Union a few weeks ago, announced a comprehensive initiative on mental health at EU level. And that's very significant because it puts the topic, as I mentioned, very, very high in the agenda. And it is very, very well in line with the EU strategic framework on health and safety at work for the period 21-27, which was adopted last year. And in this strategic framework, which somehow establishes the main lines and the main priorities for the forthcoming years, there are three main, let's say, cross-cutting objectives. The first one is anticipating and managing change, especially in view of the green and digital transition. And this is closely related with mental health, as we will see a little bit later. The second cross-cutting objective is improving prevention, continue improving prevention, not only of accidents at work, but also of work-related diseases. And in this package, let's say, of work-related diseases, mental health issues are having a very prominent role, as you all of you now know. No? And the third cross-cutting objective is increasing preparedness to any potential future health crisis. And that's very logical because, well, this strategic framework was adopted last year in 2021 in the context of the pandemic. And the pandemic has taught us a lot of important lessons on the priority to be attached to mental health. This is not only a topic for experts and for policymakers. Now, everyone is interested, I guess, and is concerned about the developments, especially after the pandemic, as I say, because it has triggered a lot of attention and a lot of interest. No? I was mentioning the digital transition. And that's particularly relevant. And well, our professional deformation in preventing risk is focusing only on the problems, on the threats, on the challenges. But as regards the digital transition, we have to acknowledge and to see that there are also a lot of good opportunities for improving things. So let's try to be balanced in this approach. But it's true that artificial intelligence or some new technologies can bring clear challenges. No, for instance, recent data from the European Agency for Safety and Health at Work, the Bilbao agency, you call because it is placed in Bilbao, disclose that workers that are working in an environment in which artificial intelligence is implemented in some ways, tend to report a higher degree of psychosocial risks. And that is something to which we are paying a lot of attention. Some years ago already, this Bilbao agency, EuroSA, carried out a very ambitious project on older workers, an overview of analyzing the challenges to which older workers are confronted. And mental health and psychosocial risks were one of the main topics in this ambitious pilot project. This was the opportunity to launch a very broad campaign, very ambitious one, the Healthy Workplaces for All Ages, already 5 years ago, 2016, in which the approach was not only to take care, to focus on older workers, but to ensure safer working conditions at all ages and ensuring health and safety at work in the whole cycle of the overall working life, because this is the real challenge. Of course, we have to pay a lot of attention to the particular challenges and circumstances of older workers, but we have not to forget the importance of keeping attention also on young workers since they start in the labor market. No? I also take this opportunity to announce that from next year, 2023, the EuroSA, the Bilbao agency, will carry out a pan-European healthy workplaces campaign on digitalization for the period 23-25. And in this campaign, in which a lot of elements will be analyzed, including the provision of practical tools to deal with digitalization, a very particular attention will be paid to psychosocial risks and mental health issues, for instance, robotization, artificial intelligence, and all these new elements that now they are not the future, they are already there. No? I will also mention a quite extensive overview research on psychosocial risks and mental health at work that will be carried out also by the European Agency of Bilbao in the period 23-25, because we need to know specifically all the key elements in the topic for founding our evidence-based policy. And I will be very brief. I will end by mentioning the European Care Strategy. It was adopted very recently, and in order to address all the aspects related to care, health and social care in the European Union. And this strategy pays a lot of attention to the psychosocial aspects of the carers, either professional or familiar or voluntary, because it is obvious now that we have to take care also of the health and the mental health in particular of the people ensuring care. I think I will stop here, and I remain at your disposal for any question, any comment, any remark. Thank you very much.
Thank you so much for this great overview, Francisco Jesus. And indeed, many things happening at the EU level, and it's very welcome to have seen in the State of the Union this comprehensive initiative, and we're really looking forward to it and following it quite closely. I know this is something that's on my colleague Dorota's agenda and her radar. So I wanted to see, are there any questions? We're opening for our first Q&A before we have to let you leave. I know you can't stay with us. I'm looking to see if there are any hands raised. So this is a great opportunity for those for joining us as participants, if you have any specific questions you'd like to make to our colleague from the Commission. Looking to see, don't always see the hands. So checking to see if there are any hands. Not yet. I did have a question myself. I wanted to ask a bit, because I understand next year is also going to be the year of skills, that it's been identified that next year will be the year of skills. And it would be interesting to know a little bit more about how that links into these questions of health and safety, and if there are considerations around upskilling or reskilling that get to this point of improving prevention, if there are any sort of explicit ties there that you could speak to.
Thank you very much, Alison, for this very, very pertinent question. Skills is certainly a key element, and this will be addressed, as you mentioned, next year in the European year. And when talking about our policy field, let's say health and safety at work, is quite obvious that having a skilled workforce is an excellent, is not an alternative, is certainly an obligation, because in order to ensure better working conditions, it's obvious that a highly skilled workforce is a prerequisite, not only for ensuring doing their purpose and their job, but also for keeping themselves aware and able to deal with the challenges. And in particular, the challenges linked to the very quick evolution of everything, of the war, of the labor markets, of the new technologies. So over the last years, and this will be somehow culminated next year, skills are also in the, let's say, in the top of the interest, and it's something that is cross-sectoral, because it's interesting for many different purposes on top of the specific element of health and safety at work. That's in a nutshell my reflection. Thank you.
Yeah, thank you. No, that's great. And I think very important, the question of psychological resilience to what you've said around the change, the pace of change. It's so quick that, and certainly COVID has only accelerated that as we're all sitting here behind our screens. So yes, thank you for that. I think I did see a question in the chat. And I'm sure I will pronounce your name wrong. I'm so sorry. Gyusi Drogu, forgive my pronunciation. We have a question. Are there some formal EU guidelines available for promotion of mental health at work? And that includes both physical and remote work.
Mm-hmm. Yes, there are guidelines. There are, by the way, a lot of materials made available by the European Agency for Safety and Health at Work, including some guidelines. I will have a quick look, and I will put the link in the chat, and you will see that there is a lot of research and a lot of not only research but applying research in practice in form of guidelines. And we are looking forward to this initiative on mental health announced by the President of the Commission. Internally, we are still discussing about the specific details on that, so this is not yet available. But I'm sure that many interesting elements will also be arise from this ambitious initiative on mental health at EU level. Thank you.
Thank you. That's great.
I see another question from Dorota.
Yes.
in the chat. What specific actions can we expect to make sure the most vulnerable work, considering that not only in high-tech technologies but also in essential services, will be put on the table? In other words, how can we ensure that actions are equitable and participatory? Excellent question. Thanks, Dorota. Yes. Vulnerable workers are particularly at the focus of our actions, and specifically and this is also one of the lessons of the pandemic. The challenges affect all of us, and all of us have lived during the pandemic in this challenging situation. But a particular attention has to be paid to the more vulnerable for different circumstances, for the precarity of their contracts, for the particular cases in sectors. Platform workers tend to be particularly, or during the pandemic, we saw, for instance, the case of seasonal workers that were very heavily affected, and directly by the impact of the pandemic, and more, let's say, indirectly by all the surroundings working conditions. So in our policy action, we pay a lot of attention to vulnerable workers, and this is mentioned in the EU strategic framework for health and safety at work 21-27. So that's the message. And when analyzing the overall approach is to take care of the health and mental health of everyone, but being aware that some groups and some groups of workers are particularly vulnerable. And in the previous previous analysis, and in the specific actions, we take a very close look on vulnerable workers. I hope having replied to your question. Thank you.
Okay, I see a thumbs up from Dorota. And already time is flying. I see we're a bit behind schedule already. It happened so quickly. But are there any other burning questions that the audience would like to ask before Francisco Jesus has to leave us? I don't see any coming, but I also can mention that we're happy to, if something comes up, for example, during the networking, and you think it's a good question to bring to the Commission, we're happy to help facilitate that you can be in touch directly and ask any follow-up. We hope this is just an initial conversation, and this, as we said, contributes to other discussions around health and safety at the workplace, and particularly mental health for older workers. So with that, then, we'd like to thank you again very much, Francisco Jesus, for taking the time to join us and to share all of your knowledge. And now I would like to pass the floor.
Thanks to you.
Yes, thank you. Thank you so much. I'd like to now pass the floor to our colleague Jason Maurer, who is joining us from the WHO Regional Office for Europe, where he works on mental health communication. And he will be presenting on the Pan-European Mental Health Coalition and focus on work inequity. So looking very specifically at the WHO Europe Mental Health at the Workplace Guidelines, which were also recently released. So Jason, the floor is yours.
Thank you so much, Alison, and thank you so much, Jesus, for the excellent overview. Yeah, can we go back to the first slide? I think that's, yeah, great. So I guess to start, to avoid going too much detail into this, because we're all here because we know that addressing mental health at work is a very big issue and a big priority, both in the recent past and hopefully going forward. The WHO has, as Alison mentioned, released a set of comprehensive guidelines for policymakers and employers directed at how to improve mental health at work. And in the process of developing these guidelines, there was a lot of data that came out that justified exactly why we need these. To briefly summarize that, 1 in 6 working age adults are estimated to have a mental disorder, and that is according to the ICD definitions, rather than all mental health conditions, which would in fact inflate, I'm sure, the number quite a bit. And it is incredibly costly, with about $1 trillion in costs per year across the world. It has been tackled before in some capacity. However, it has only until recently been put into formal frameworks like these guidelines. So there's the WHO Comprehensive Mental Health Action Plan, which was launched in 2013. Later on, there was the WHO Global Strategy on Health, Environment, and Climate Change, as well as the much earlier ILO Convention on Occupational Safety and Health. So there is work being done. There has been work being done on this for quite a while, but only recently have we got enough data to begin putting it into a policy guidance capacity. And this is in part because there is quite a lack of data. There's a lack of regulation for interventions related to mental health at work. It is, as you all know, quite a new field comparatively, only taking root at the policy level within the last 20 or so years. Next slide, please. So that providing that overview, I now want to narrow down to what we at WHO Europe are doing in the context of mental health at work, as well as situated within mental health in general. So last year, in September, we launched the Pan-European Mental Health Coalition. This is a network of organizations and individuals, ranging from high-level actors and government representatives to individuals with living with mental health conditions and advocates. Its primary aim is to harness the collective wisdom and expertise of all of its members and supporters to advance the objectives of what the guiding framework, which is called the European Framework for Action on Mental Health 21-2025. This framework was endorsed last year as well by all 52 member states for the WHO European region. And since then, it has been used as the general guiding framework for our work in the coalition. We like to imagine the coalition as kind of a house where the framework objectives are the roof, which is being supported by 6 working packages, all based on a firm foundation of mental health data. Could we go to the next slide, please? So as I said, there are 6 working packages to the coalition. They align with 3 priority objectives of the framework, but we thought a little bit more nuance was needed in order to fully capture what was necessary. And even then, we understand that it really doesn't do justice to the enormity of the task at hand, because one of the main principles of the coalition is that, unlike in the past, the mental health can't be just located in the health sector. It has to be cross-cutting across all of society. It has to have the involvement of every form of system, including and especially employers and workplaces. So as you can see, it is a fairly artificial division of labor across these 6 working packages. We acknowledge that it is essentially due to our own capacity limitations that we can't yet integrate these into a much wider system, but rest assured they are being they're in constant communication with each other, and we are doing this merely to ensure that we have some areas of work to show. And as you can see from there, mental health in the workplace is the focus of working package 4, with the goal of supporting member states in developing mentally healthy and safe workplaces. Because, as I should say, the coalition as a network and as with its main purpose being knowledge sharing and information and in peer learning, we are aiming to support member states, support countries in strengthening their own policies, their own methods of their own interventions and their own workplace support mechanisms in order to ensure that this objective is met. Next slide, please. So earlier this year in May, we had the first meeting of the coalition, and we will actually be holding the second meeting in Ankara, Turkey, later in November. But it was a fantastic meeting. We saw many people, experts, representatives of member states gather from across the region to really crack down in small working groups to begin work on producing content and identifying the areas, the specific areas that we'll be working on in each working package. So as you can see from this table, working package 4, we tried to break it up trying to be helpful as possible for readability into challenges, goals, and actions. What are the main challenges that people have noticed in their work, as well as through aggregation of data, to begin really tackling as we go into working for mental health in the workplace? What are the general goals we can try to meet to address those challenges, and exactly how do we reach those goals? So implementation is one of the most important aspects of the coalition, because a lot has been said about mental health, and a lot has been said about how to what needs to be improved, but not a lot has been done. So we're trying really hard to keep that implementation in focus. And as you can see just from here, that fragmentation of the working packages is really just an illusion, because there is so much overlap, especially with working package 4 and working package 3, which focuses entirely on older adults. For example, one of the main challenges that was identified for supporting mental health of older adults is ageism and stigma. And that is certainly going to deny a lot of older workers from finding employment, from keeping employment, and from receiving support when they are identified to have a mental health condition while employed. So already there is a degree of interaction there that we need to support. Next slide, please. So this leads me to broaden out a little bit again to the WHO guidelines for mental health at work, as well as the accompanying ILO and WHO joint policy brief. These were launched in September of this year, to September 28th, and they are truly, again, focused on how do we what is needed to improve mental health at work, at the policymaker level, as well as at the employer level, and how can they go about implementing that? So again, implementation is a major focus, especially of the policy brief, which is designed specifically for policymakers and employers to use actively in improving and implementing changes in their workplaces or respective contexts. Both are highly evidence-based. They were developed through over a year of reviewing the latest literature, as well as consultations with experts from across the region. Next slide, please. They have been, through all of that, they have distilled 3 strategies aimed at for policymakers and employers to improve mental health in the workplace. And those are broadly prevent, protect and promote, and support. So for prevention, the work environments need to be shaped in order to minimize psychosocial risks and prevent workers from experiencing health conditions in the first place. Following on that, there is a need to strengthen awareness, skills, and opportunities, such as through manager training, creating supportive cultures to act on mental health issues to protect and promote the mental health of all workers. And finally, supporting workers who already have mental health conditions through return to work programs, supported accommodations, and the like. Next slide, please. And finally, these are also, in order to facilitate these these priority actions, strategies, there are 7 cross-cutting actions which are listed there. It is important to for me to acknowledge here that the guidelines are a very broad, generalized product. They're meant to apply across, they're meant to apply globally. So there will need to be work done, very much like what EuroHealthNet has done with the policy briefing on older mental health of older workers, to distill and specify what is necessary in particular context, including in the European region, as well as for certain target vulnerable groups such as older workers. So in the future, the coalition is going to be working in adapting these guidelines, specifying them, and ensuring that they are applicable to more specific contexts. And yeah, that's me.
Thank you so much, Jason. That was great. Really, yeah, it's again a lot of information. So I hope our participants in the audience are capturing it and digesting and can come back. I think I know you can't stay all the way through the day. I do want to go to the next speaker, but I think there's one essential question that I can ask on behalf of the room would be if there's a way for people to still get involved. If they're not already involved in the Mental Health Coalition, how would they go about getting involved?
Yeah, I will post the email that you should write in order if you are interested in joining, and then my colleagues will take that forward. And I also will post links to the coalition website and the various guidelines that I mentioned.
That's perfect. That's very helpful. And then we can also collect that information for the final report. So thank you so much. And yes, again, everyone should feel free to send questions to the chat if they'd like. So that's very welcome. And I think it's great, the focus on implementation, and really we congratulate the coalition for all the work that you've done. And I know some of us in the office are getting quite excited for that second coalition meeting. So I will now pass the floor then to our colleague joining us from Age Platform Europe, Sarah Loriato, who is the policy officer on employment and participation. So Sarah, thank you for being with us, and the floor is yours.
Hi, everyone, and thank you, Alison and Dorota, for the opportunity to address the mental health of older people and specifically the mental health of older workers. At Age Platform, as you said, I'm working specifically on employment and participation at older age, and I'm glad to discuss with you such an important matter. In this presentation, I will address what greatly impacts mental health as we age, starting with ageism. Can we go to the next slide, please? So yeah, first of all, I will address ageism as a factor of stress and anxiety, and then I will go much deeper into the specific case of informal carers. Next slide, please. So first of all, we will discuss the concept of ageism, even if it's a pretty well-known concept, but I would like to see how it impacts the mental health of other people in everyday life and in several areas, such as within the framework of employment. So what is ageism? We have a pretty good definition of what it is in the UN Global Report on Ageism. It refers to the stereotypes, prejudice, and discrimination directed towards people on the basis of their age. And if you take only other people, it is how we think about other people, how we feel about other people, and how we act towards other people. Next slide, please. According to the 2019 Eurobarometer report on discrimination in the EU, age discrimination is the most frequently experienced form of discrimination. Ageism manifests itself at the individual level, meaning that it can be directed at ourselves, but also at the interpersonal level and at the institutional level. As reported by the UN Global Report on Ageism, more than 1 in 3 people over 65 have been a target of ageism. And this translates into different reactions, fear of aging, discrimination in the workplace, exclusion from health insurance, age limits in the collection of certain statistical data, etc. Next slide, please. So ageism has consequences on our societies and in our economies, but most importantly, it has serious effects on and far-reaching consequences for people's health and well-being. It leads to physical and mental health faster decline. So we've seen that those with negative perception of old age have a decreased life expectancy of 7.5 years. It affects memory, autonomy, and self-esteem. And also, more broadly, it erodes policy support for older people, financial security, and increased elder abuse and human rights violations. All of these have crucial impact on the mental health of older people. Next slide, please. Yeah, during the pandemic, ageism towards other people became more and more important as the virus was first presented as an old people virus, and it took several forms, such as an unprecedented amount of ageist comments in the media. Older people were stigmatized as frail, passive, or a burden. And on the other side, still older people were not the priority when, and they were actually often discriminated for instance, life-saving interventions. It undermined people's autonomy, dignity, equal worth as a human being, and all of this importantly affects the mental health of older people. Next slide, please. In the frame of work, ageism is of course also experienced by other people. It is first important to note that ageism towards other workers happens in all professions. Among others, the consequences of ageist attitude at work can be seen in the lack of access for paid training by employers, or for instance, the fact that they are less likely to have a job that offers good prospects for career advancements. Finally, experiencing ageism is strongly related to poor mental health as measured by depressive symptoms, anxiety, and general stress. And actually, there is a study in Finland where more than 6,000 employees revealed that perceived age discrimination at work led to subsequent long-term sick leave. Next slide, please. So among the factors responsible for psychosocial risk and threatening mental health, we have addressed ageism, and another factor that plays also a critical role in the well-being and mental health of older workers, it is the balance between professional and personal life. And to illustrate this aspect, I would like to address the specific case of informal workers. Who are they? The informal carers. I made a mistake. So the informal carers are all the people providing support on care on a voluntary basis. At least 44 million people have been involved in the provision of informal care in Europe. Currently, it represents 80% of care provided by informal carers. And most of them are women, among whom many in the middle age or late middle age. Most of them are still of working age, and they have to cope with the loss of autonomy of their aging parents or relatives, and they mainly struggle to stay in employment. And this is something that is becoming the reality of more and more people because of demographic change, which means that we will have more older persons in need for care and assistance, but also that family carers are expected to remain at work while their aging parents or relatives starts needing care. Next slide, please. Here, it is important to spot the gender inequality in unpaid care provision. Care responsibilities are most often assumed by middle-aged women, as I said, and this has deep effects on their well-being and their employment situation. For instance, often carers have no choice but to withdraw from the labor market to care of their relatives, and they may be penalized for that. So not only in terms of lost professional income and career development, but also in terms of lower pension entitlements, lost rights to social protection after this care period. And the situation fits the gender employment gap, the gender pays and pension gap, and it puts women at risk of poverty and social exclusion. Next slide, please. There are many consequences of informal care that can put the mental health at risk. There are multiple. Here is a non-exhaustive list, but increased overworked, persisting imbalance between work and family, and of course negative impact on both professional and individual well-being are some of them. Next slide, please. And here are some numbers to show how the pandemic has increased demands on unpaid careers. And these shifts are expected to continue. So, for instance, we have 3 in 4 informal carers that feel more burnout than ever before. And for instance, also half of them say that being a carer negatively impacts their career. Next slide, please. Here are a few ways to support them. We are thinking about flexible working, of course, but here I'm mainly thinking about how to improve employers' knowledge about the different options possible, because sometimes they only have one option in mind while there are plenty. Another point would be to develop an age-positive culture through the recruitment process, but also in developing age diversity teams. We can also think about providing better accessibility of health and mental health support at work, and encourage career development at all age. I just want to say that, of course, there is the work-life balance directive and the EU care strategy that we talked about before, and they address some of these points, but it is important to note that they are only a first step in addressing the well-being of informal carers, and that we must go further in supporting them. Next slide, please. And yeah, just to finish announcing that as every year, next year it's in a year from now, but we will release an age barometer, and within this barometer, which usually assesses the socioeconomic situation of older people. Specifically in this one, we will address the well-being and the mental health at work and have an overview of what's in place in different EU countries. Thank you.
Thank you so much, Sarah. Yes, that's we've been reading a lot of materials, but I still found some of those statistics so shocking as you presented. You know, the 7.5% drop. I mean, that's a public health emergency. You know, this is something that I think is just not getting enough. It has not been getting enough attention, but as you say, steps are being taken, and you know, initial steps, the care strategy, the work-life balance directive. So some encouraging steps, but still a lot of work to do. I was also shocked by the 80% of care coming from informal care. And again, I read things, but it's somehow you see these and it just hits you anew. What a challenge this is. And thanks, you started to drive towards some great solutions at the end. And I think that that's exactly where we'll go now with our final presentation. We are a bit behind schedule, so I hope that we can just take the conversation right into the networking, and we can kind of blend the Q&A and the networking together as an opportunity to kind of build on some of the potential that we heard in these presentations. So with that, I'd now like to hand over to my colleague Dorota, who we've already lightly introduced, our policy manager here at EuroHealthNet, who's going to be talking about occupational psychosocial risks and mental health of older workers. And thanks once more to you, Sarah, for the great presentation. So Dorota, the floor is yours.
Thanks so much, Alison. I hope you can hear me all right and see me all right. Yes, thanks to all for being here today. I've prepared a presentation on occupational psychosocial risks and mental health of older workers, but basically to kind of showcase our latest policy brief that includes and discusses and presents the strategies and some strategies and pathways for progress to move on this important topic. And the strategies are mostly for policymakers, employers, and practitioners active in the field. Yes, so I'm Dorota Sienkiewicz, and I'm a policy manager at EuroHealthNet. EuroHealthNet, a European partnership for improving health, equity, and well-being. And for us, the focus really is on, in addition to just monitoring the EU policy or health in all policies environment, is to encourage exchange of good practices and generate evidence on what works for whom and how this could be implemented on the ground, pretty much. Next slide, please. Yes, so just very quickly, because I'm aware of the time taking off, why we need to act. We are all here today because we need, well, we probably know why, and it's quite an urgent topic. So just very quickly go basically to the end, because I wanted to really focus on the fact that what we are trying to do as EuroHealthNet and with our policy brief and the strategies is to add to this kind of ongoing discussion on the healthy and health promoting workplace environments, becoming really or re-entering the priorities for the EU legislators and European member states. It is already important. It's going to be even more important for economy, longer working lives, all the costs associated with disability, sickness, etc. And it's, as we've heard from Jesus earlier, it's firmly set in EU frameworks and instruments. And what I also wanted to stress at the beginning here is that we really want to put a finger on the fact that the responsibility to act and get better is not just put on individuals, on the individual workers, but also on governments, organizations, and employers. So basically, everybody has a role to play in this complex environment. And while psychosocial risks affect all workers, we know that certain groups are more vulnerable than others. And with our strategies, the policy brief, we also dive into a gender dimension and aspects related to the COVID-19 pandemic. And I really refer you to take a look at them. So with all of this in mind, we've noticed that there's really little research into what works and why, and the specific focus here put on the translation and the implementation research, so from the policy into practice, and kind of strategies and tips on how to maximize the assets of the silver economy and encourage, indeed, as I already said, the exchange of good practices between member states. Next slide, please. So yes, last week we've launched our newest policy brief, which really lays out strategies to promote workplace well-being, with a big focus, or a particular focus, on protecting older workers from psychosocial risks. And it's really to mitigate further social and economic challenges, and also eventually contribute to achieving an economy of well-being. That's a kind of another bigger kind of narrative in the health promoting approaches and narratives that we wish to kind of expand on further. Next slide, please. So just a kind of very quick list of what we found out, or we laid out the main psychosocial risks specifically for older workers could be, and the list is by any means, a kind of exhaustive. It's just to kind of start discussion and furthering the conversations around the topic. The first one, we thought it's important to discuss the effort-reward imbalances, and here the social value of work carried by aging population, for example. Further on, discussing workload and work schedules, work content, and the design of the tasks that the aging population or the older workers carry out. And that's particularly important in the context of the fast changing working demands, working environments, and the mental and physical needs and conditions that the older workers may or may not have. Further on, we dive into issues related to a feeling of control and role in organization and participation in decision making. We discuss issues related to work-related stress, and that has a particular relevance in terms of help-seeking behavior and different coping mechanisms that are quite specific for older workers. And further on, we talk about, we list job insecurity and career development prospects as one of the key psychosocial risks for older workers, and that relates to what Jesus earlier said, the types of contracts, the prospects for lifelong learning, the continuous professional development, and gaining the skills needed to perform the tasks. And the two last psychosocial risks are the work-family interference, and that has to do with the work-life balance and caring responsibilities. I'm not going to go into details into that because other speakers already talked about it. And also the labor market policies, so opportunities for return to work, unemployment and activation benefits, for example, to get back to work, and issues related to income inequalities and the cost of living. Next slide, please. So here I just wanted to spend like about a minute on putting a particular focus on the gender dimension of the occupational psychosocial well-being and the risks specifically associated to the female population on the market. Because when we're doing the desk research and looking for interesting and promising practices, we actually found out that there are quite some research gaps and very few practice and policy interventions for this particular group of workers, in particular with regards to designing preventive and psychosocial health promoting interventions. And we thought that this is, something really important and interesting to take on, considering that, for example, women of menopausal age constitute the fastest growing group in the workforce, and they report the impact of entering into this new life, I'd say, phase on the labor participation and work performance. And it's related, to hormone imbalances, emotional cycles, etc. And the female workers, the older female workers are also more exposed to harassment, bullying, and psychological violence than men. So I just wanted to spend a minute or two on that, because that's something that probably needs a bit more looking into. Next slide, please. Yes, so the strategies, and I'm just looking at the timing, and it's against me. So the strategy is to create a healthier workplace for all the workers. We divided the strategies into two main categories. One is becoming an age-friendly employer, and the other one is becoming a mental health promoting employer. But as you can see here on the slide, it's about finding the right mix. As I mentioned, in some regards, the responsibility is really on the government. So regulations, directives, strategies play a really big role here. But also then how to include into that organizational structures, so the employers, companies, and then what's within the remit of individuals. So not to just leave them on their own to get better and make sure they actually are able to perform the tasks up to their optimal performance. And the two last points are also very important. That's what we found from the research. Focus on enforcement, monitoring and evaluation, and including in low resource settings. So not only kind of staying at the level of really big companies with thousands of employers, but also looking at what can be done within the small and medium enterprises companies. And last but not least here, really leadership and participation are important, together with adequate investments, investing in skills, evidence, collection of good practices and exchange of these practices. So communication is really important. And now I wanted to just very quickly go through the 6 strategies. Hopefully I will have some time from the moderator. Just very quickly, but you can find it back in our policy brief. It's just, kind of flashcards. Number 1, encouraging lifelong learning and development of diverse skill sets. So really offering autonomy and the use of varied skill sets to increase control of the work environment and the motivation and ability to manage workloads and time pressure. It also helps to manage age-related changes and improve help-seeking behaviors. And there's a bonus point here. It's good for managers to gain knowledge and positive age attitude. Next slide, please. The second strategy that we put in the document is to offer options for flexible working. Flexible working that's proactive yet non-stigmatizing. So not everybody can work from home. Those who cannot should be adequately equipped mentally and physically to do so. And I think that's an issue that was mentioned by Jason as well. Really taking advantage of the employee assistance programs, which are based on personal needs and preferences, and supporting older workers through digital infrastructure and digital skills development. And it all really, the big focus is on consulting to understand the limitations, preferences, and enablers of the conditions, the working conditions, the life conditions in which all the workers operate. Next slide, please. The third strategy is to leverage bi-directional mentoring processes. So in addition to nurturing the kind of more traditional mentoring schemes where the line of, I'd say, management or mentoring goes from the older employees down to the younger ones, there is a kind of emerging body of evidence suggesting that reverse mentoring schemes, so from the young workers onto the old ones, are quite innovative and promising approaches to, for example, develop new skills, reconnect, gain agility to fast-changing working environments. Next slide, please. The last one in this category of strategies to become an age-friendly employer is to offer flexible retirement structures. Very often, older workers are worried about what's going to happen after, how to manage the transition, what to do socially and financially, etc. So, for example, actions designed and tailored according to workers' psychological profiles are a good thing to look into, and also increase the literacy on wider social protection and care systems. So, to know, okay, what can they expect when they are out of the job market, I'd say. Next slide, please. And the last two in the category of becoming a mental health promoting employer, it's to establish supportive policies and strengthen organizational capacities for health benefits. And here, really, the big focus is on workplace culture, organization of work, and community participation, and designing and offering trainings to managers and supervisors and workers in occupational mental health literacy and awareness. And it's really a kind of mix of bottom-up and top-down approaches to really lower threshold for psychosocial support and counseling, but also to establish and enforce measures to combat workplace harassment, bullying, stigma of age and mental ill health, and employ an open communication, active listening, encourage help-seeking behavior, etc., etc. And the last slide, please, among the strategies, is to identify mental health promoters and promising programs within an organization or an institution. And it also relates to engaging other workers to benefit from programs and support small and medium enterprises in mental health promotion prevention efforts. As I mentioned, it can be a kind of barrier to the fact that not everybody is able to benefit from such interventions. Yes, I mean, more information is, of course, here in the slide and in our brief. And just last slide, please. Before I finish, I just wanted to showcase here 3 interesting case studies or practices that we also included in our brief. And I hope maybe that will be, we can discuss it a little bit in detail in the networking session, because I think some people who own the practices here are present as well. But just very quickly, in Finland, there's a very interesting program called Vero 55+. Implemented by the Finnish Tax Administration Department. And it's really to increase the feeling of being in control of the workplace among older workers. And it includes a lot of interesting interventions and tools to help really people in feeling being heard and more in control. Another interesting project program is the Slovenian Star Vital project, which is publicly funded to promote vitality in older workers, healthy lifestyle habits, etc., etc. And there's a big focus on stress management and interpersonal relationships and intergenerational cooperation. So everything that was mentioned already before. And last but not least, CRODIS Plus, so the joint action that finished a couple of years ago, produced an interesting training toolkit for workplaces. And I'd be happy to add perhaps links to all these good practices in the chat. But this one particularly actually is a collection of 127 evidence-based resources for managers and workplaces to foster well-being, health and work ability for all employees, so all ages, but there's a focus also on mental health and psychosocial well-being here. And with this, I just go quiet. I'm happy to answer any questions and share the resources in the chat. Thank you.
Thank you so much, Dorota.